Let's talk health. In some nations across the world, the news of Nigerians proving clearly that they understand their craft keep pouring in. One of them is Dr. Dennis Agbazwe, who is among the few spinal surgeons in South Africa. He performs both Uni-Portal and Bi-Portal endoscopic spinal surgeries, but he started practicing the Uni-Portal technique in 2022 and has since used it for about 330 cases. Dr. Agbazwe says using the Uni-Portal technique for the performance of endoscopic spinal surgeries is one of the least invasive ways to perform the type of surgery. The procedure involves a Bi-Portal endoscopy on the L4, L5 lumbar spine, along with a bilateral laminectomy to relieve pressure on the spinal canal and surrounding areas, as well as a disc removal and spinal fusion. Well, Dr. Dennis Agbazwe himself joins me live now to share his experience and his hopes. Good to have you join us, Dr. Agbazwe, and congratulations on what you were doing. Between 2022 and now, you have performed the Uni-Portal endoscopic spinal surgeries for about 330 cases. How has it been, and how do these processes differ from the traditional open procedures?
Well, endoscopic spine surgery is a modern technique of addressing spinal conditions where one makes a small incision, less than a centimeter, to introduce a Uni-Portal camera, or one makes two incisions of about the same size to introduce a camera and a working portal that is called the Bi-Portal endoscopic spinal surgery. It differs from the traditional spinal operations in the sense that it's very, very minimally invasive. One just makes an incision on the skin and the subcutaneous tissue, and the rest you use tools that dilate and track its way all the way to the spinal tissue where the problem lies. As opposed to traditional surgery where you make quite a big incision, you have to strip the muscles, strip the ligament, and that causes a lot of bleeding and an infection. So this technique, it's a very innovative and a slick way to address spinal conditions.
All right.
And the patients do recover very quickly. They can go home the same day after surgery, the most the next day. So it's really revolutionized the way spinal surgeons manage these conditions.
All right. Now I'm curious as to how Nigerians in the diaspora like you can contribute really to the growth of the healthcare system, especially back home. How can you collaborate to help our country, Nigeria?
Yeah, we always think about home. We need to definitely collaborate with our peers all over the world. I mean, the Nigerian specialists are among the best in the world. They are scattered everywhere. So we need an enhancing environment. We need to collaborate with our colleagues back in Nigeria. Some of us are already making strides in that direction, but we need more of that, where we can bring the expertise we've acquired outside to help our people in Nigeria. I think this is the future, and we need to foster all the efforts in that direction.
I know there's something the president says about from having a plan to move the trend from Japa, like people leaving the country, to Japa, having them come back home. I'm really looking forward to how you can of course work with people back home, and we'll see how it happens. But how can people access this kind of care, this innovative way with the Uni-Portal and Bi-Portal initiatives now?
Yes, we've got a website which anyone can access from any part of the world. And we do have patients coming across different parts of Africa. Our main practice is situated in Johannesburg, and we can easily be reached. It's just as much as the people going on the website and seeing all the services offered. And we also plan to come from time to time to Nigeria and collaborate with local surgeons in cities like Lagos, Abuja, and Anambra State and different parts of the country, where we just need to cooperate and collaborate with our colleagues, our peers in Nigeria. And this is possible. It's definitely possible because you don't need a lot of post-op management, like intensive care unit and a very highly skilled nursing staff. We can help to train the staff to manage these patients. The patients are pretty much on their own. A day after the operation, they are working, they need little assistance. So this type of innovative surgery can definitely work in a country like Nigeria.
You know, I was glad when I heard you mention that the patients who undergo this can actually even be released to go to their homes on the day of the surgery. We look forward to, you know, the much more impact we can do with this and help our people get the needed care. Dr. Dennis Agbazwe is Nigerian-born orthopedic, spinal endoscopic surgeon and interventional pain specialist. Thank you so much for your time on Well Now.
Thank you so much.